Welcome to another edition of Global Nerve Advancement, where we discuss the latest in nerve research with the authors. I'm your host, Ann Ingeman, a member of the Global Nerve Foundation Research Committee. And today we have with us Dr. Frederik van der Cruyssen. Dr. van der Cruyssen holds both a medical degree and a dental degree, as well as a PhD, and is currently in the Department of Oral and Maxillofacial Surgery at University Hospitals Leuven in Belgium. Welcome, Dr. van der Cruyssen.
Thank you for the introduction.
Yes, well, we've asked you here today to discuss your recently published paper on consensus guidelines for trigeminal nerve injuries. Since we at the Global Nerve Foundation got to play a very small role in helping you with the study. So if you'd like to tell us about that, we'd love to hear about it.
All right, so recently we published a guideline on trigeminal nerve injuries. And in brief, trigeminal nerve injuries can occur in many oral, maxillofacial, or dental procedures. Around 3% of patients undergoing routine surgery in the head and neck area will suffer from a trigeminal nerve injury. And from other studies we did, we see that these patients really suffer from their injuries. They have problems with speaking, eating, drinking, kissing. Any daily life activity we take for granted can be compromised in these patients. And on top of that, we see that physicians struggle with these patients. We have large referral delays in this patient group, and we see that patients get underdiagnosed and undertreated, or even some of them get overtreated due to medical shopping in this patient group. So when we talk to physicians in primary and secondary care, we see that they struggle because they don't have guidelines. So we went ahead and we attempted to publish the first guideline on trigeminal nerve injuries. To accomplish this, we surveyed international experts in the field, including urologists, maxillofacial surgeons, orofacial pain specialists, anesthesiologists, and so on. And we provided them with a list of statements in 4 domains, including services and training that is thought to be needed for these patients, diagnosis, treatment, and follow-up for trigeminal nerve injuries. And we based these statements on the best available evidence after conducting a scoping review. And then the experts had to indicate for each statement on a Likert scale the extent to which they agreed with the statement. And we did this in several rounds and to reach a final consensus for each statement. At the end of the questionnaire, the physicians or the experts were also presented with 3 summary flowcharts in order to summarize the best evidence. And these flowcharts I will present right now. We used a predetermined statistical methodology to calculate the consensus for these statements. First of all, I want to show you the agreement we reached. So 78% of statements considering training and services needed reached consensus. And we can also see that diagnosis and the flowcharts had a high consensus rate amongst our expert group. But when we talk about treatments for trigeminal nerve injuries and the follow-up that should be done, we see that consensus was reached in only about half of the statements. So there is still work to be done. And here we see the first summary flowchart agreed upon by all the experts. And it's a neurosensory testing algorithm. It's based on evidence from the past, but we modified it slightly based on new insights. And we summarized testing algorithm, a clinical neurosensory testing algorithm for physicians to use in primary and secondary care of these patients. Next, we have a diagnostic flowchart. And first of all, I want to stress that we defined 2 emergencies for immediate referral to an expert in trigeminal nerve injuries. And these are observed nerve transections and severe nerve compressions. And then depending on the severity of injury, we propose a different flowchart where we want the patients with severe injuries, we want to see them as early as possible, because we believe that an earlier intervention will result in better outcomes. So these patients with the severe injuries, we want to see them right away. So this is in essence what's presented here. And then finally, we also present a treatment flowchart for all our patients. Not unimportantly, it was decided that the psychosocial aspect is also very important to consider, and it should be provided to some of our patients. And then we made a distinction between pharmacological treatment and surgical treatment. In the pharmacological treatment, we know from literature that it's important to make a distinction in patients with neuropathic pain and patients without a pain component. When there is a pain component present, we follow the neuropathic pain special interest group guidelines, which were published a couple of years ago. And we follow them up regularly 4 to 6 weeks after start of treatment. And depending on the result, we can titrate the dose or switch to another drug. And then we also made some recommendations when surgical treatment is appropriate, which kind of surgical treatment should be followed for the nerve injury decompression and then the repair, if that's possible. So that's in summary our recent publication in the International Journal of Oral and Maxillofacial Surgery.
Well, thank you for that overview of your study. I know it's a very important study in trying to get consensus on how to treat these types of injuries. I'm curious to know something. I know in table 2 in your paper, you provide a really interesting long list of future research opportunities in trigeminal nerve injury. And I'm curious just to know what you might be most excited about on that list, or what you think is the most needed.
I think we should first focus on better diagnosing patients. So the patient stratification, selecting the correct patient for surgery, I think is the next step. And so we need research in comparing outcomes in different patient groups. And for that, we already started with a multicentric study to compare outcomes.
Wonderful. Well, thank you so much for joining us today and sharing your study. And hopefully the flowcharts will start to get used and help improve outcomes for more patients with these types of nerve injuries.
That would be great. Thank you so much for the invitation.
Wonderful. Thank you.